Okay, so get ready because today we are really diving deep into what's going on with German hospitals.
Yeah.
And, I've got to say, after reading this report you sent over, I'm a little worried.
Yeah, it's
It's not exactly the kind of light reading you want with your morning coffee.
not exactly a walk in the park, no.
So, for our listeners, we're talking about this really in-depth study, the Krankenhaus Study 2024, put out by Roland Berger. They surveyed like over 650 hospital leaders all across Germany, which is a lot.
Yeah.
And, well, the results are, how do I put this, pretty alarming.
Understatement of the year. We're talking about a full-blown economic crisis, and it's hitting German hospitals hard.
And not just like, oh, we had to cut back on the free sponge baths kind of hard. This is serious stuff.
Oh, absolutely. The report straight up says that 70% of German hospitals are operating at a deficit right now.
70%? That's wild. So for every euro they're spending, they're only making back, what, 70
You
euro?
got it. And that is not a business model for success. No way you can keep that up for long.
It's like trying to run a marathon with, like, a sprained ankle and shin splints. You might finish, but it's not going to be pretty.
And you're probably doing some serious long-term damage along the way.
Exactly.
Mm.
And speaking of damage, almost half of the hospital leaders in this survey said they are worried, like really worried about their liquidity.
Right, and that makes sense, right?
Well, yeah, I mean, liquidity basically means having enough cash on hand to, pay the bills and keep the lights on. Right.
Exactly. And when you're already operating at a 70% deficit, well, keeping those lights on gets a whole lot harder.
So how did things get so bad? Was this like a sudden storm, or has this been brewing for a while?
It's definitely been brewing, yeah. German hospitals have been walking this financial tightrope for years now, always trying to balance the books, struggling with these really long, drawn-out budget negotiations.
So they're already on edge. Then what? What happens?
Then you add in the ever-increasing cost of, well, everything. New equipment, building upkeep, you name it. It's all more expensive. That tightrope, suddenly it's a lot thinner and they're wobbling a lot more.
Oof, yeah, not a good visual. And I'm guessing this isn't affecting all hospitals equally, is it?
Sadly, no. The report shows that public hospitals, your big essential hospitals, are really hurting.
We're talking about those like super specialized facilities, the ones that handle the really complex cases, right?
Exactly. And according to the report, if things don't change and change fast, something like 30% of them could be facing insolvency by the end of next year.
30%. That's huge. All right, we need to unpack that, but first, a quick break. 30% of German hospitals facing insolvency. I mean, that's not just a few hospitals closing. That's like a whole healthcare system on the verge of collapse.
It would be absolutely devastating, no doubt about it. And the ripple effects, huge.
Yeah, no kidding. Okay, I need a minute to process that. Deep breaths, everyone, deep breaths. But, before we all spiral into a full-blown panic, the report did mention a few glimmers of hope, right?
It did. It did. And the funny thing is, well, maybe not funny exactly, but interesting, the most optimistic folks in the whole survey, the ones who seemed the least worried about this whole thing, it was the larger hospitals, the very ones who, on paper at least, seem to be facing the biggest challenges.
Really? Now that you mention it, I think I remember that. But why? You'd think they'd be the ones stocking up on bandages and hand sanitizer, bracing for the apocalypse.
You'd think so, right? But I think a lot of them are seeing this whole crisis as, well, maybe a chance to hit the reset button on the German healthcare system. It's like, if some hospitals are going to have to close, which is a tragedy, obviously, then maybe that can free up resources and staff, and those things can get spread around to make the system as a whole stronger.
So it's like a morbid game of musical chairs, where the hospitals left standing get to divvy up the medical equipment.
I guess you could put it that way.
Yeah.
But it's more than just grabbing resources. It's about creating a system that is actually sustainable over the long term.
Hmm.
And that actually leads into the second reason for optimism, the government's healthcare reform plan.
Oh, right, right. That was in the report, too. It's supposed to streamline things, cut down on the red tape, all that, right? With the goal of making things more efficient and ultimately leading to better care.
Exactly that. Less bureaucracy, hopefully lower costs, and better outcomes for patients. What's not to love? Well, some people aren't thrilled, to be honest.
Yeah, I was thinking about those smaller hospitals we were talking about earlier, the ones that are already kind of hanging on by a thread. This whole thing has got to be pretty nerve-wracking for them.
Oh, absolutely. They're understandably worried that in all this focus on consolidation and streamlining, they might get left behind.
Right. Like, imagine you're a small town. You've got one hospital that everyone relies on. What happens if that hospital gets absorbed by some big mega hospital 50 miles away?
It's a valid concern, and it just goes to show that there's no magic bullet here. Any solution has to take into account the needs of all hospitals, and especially the patients they serve. But especially, like you said, the patients.
Totally. Okay, so we've got the long game, but what about right now? In the meantime, I mean, what are hospitals doing to stay afloat today, not 5 years from now?
That's the million-dollar question. Two things are really standing out in the report. First, they're really shifting toward more outpatient care. And second, they're really focusing on consolidating services within their existing facilities.
Okay, so less come spend a week in the hospital and more pop in, get your procedure, and we'll call you a taxi.
Exactly. Like, instead of needing a full engine rebuild at the hospital, you can just get a tune-up and an oil change.
Which, I mean, I'm sure patients aren't complaining about that. Shorter hospital stays, fewer overnights. Sign me up.
Right. And for the hospitals, it's huge. Fewer overnight stays means they can free up beds, which frees up staff and resources, which, well, you get the idea.
Makes sense to me. What about that other thing, consolidating services? What does that actually look like in practice?
So it's basically about getting rid of redundancy. Instead of having, say, 5 different departments all doing similar things, they're trying to streamline, centralize, make those services run more efficiently.
So it's like taking all those files you've got scattered across your computer and putting them all in one folder. Same information, just organized.
Exactly. And the benefit there is, well, first of all, it's just more efficient, but it can also actually lead to better care. Because if you can concentrate the real expertise in a particular area, if you can bring all the best minds together, you're more likely to get good outcomes for patients.
Yeah, it's like that old saying, two heads are better than one. Or in this case, maybe it's more like 10 cardiologists are better than 50 spread across 5 different departments.
Huh, exactly. But here's the thing. Even with all this restructuring, all these internal changes, there's this growing sense that hospitals can't do this alone.
They're realizing that they need to, like, cooperate instead of compete.
Exactly. And that's actually a big deal because for a long time, it's been every hospital for themselves. But now they're starting to see that a rising tide, it really does lift all boats.
So instead of battling each other for every patient, they're more willing to, like, maybe partner up, share resources, merge even.
All of that. They're starting to see the bigger picture, the idea that if they work together to improve the healthcare system as a whole, then everybody wins, especially patients. And that's really what matters, right?
I completely agree. It's like they're putting down their boxing gloves and picking up, like, I don't know, a plate of peace offerings.
Right. Or maybe a giant stethoscope they can all listen to together. I don't know. I'm stretching the metaphor here, but you get the point.
I do. It's about collaboration, not competition. So to sum it all up, it sounds like German hospitals are facing some pretty daunting challenges, but there are also some reasons to be hopeful.
Yeah, exactly. It's a mixed bag, that's for sure.
It really is.
Yeah.
And, this whole conversation has really got me thinking about the bigger picture here.
Yeah.
Like, we've been talking about finances and logistics and all that, but at the end of the day, this is about people's health, their well-being. And that's something that should matter to everyone, no matter where you live or what healthcare system you're a part of.
I couldn't agree more. And that actually brings up a really important question, something for all of us to think about. Will these proposed solutions, these reforms, will they actually be enough to save the German healthcare system? Or are we seeing the beginning of something much, much bigger, a fundamental shift in how we think about and deliver healthcare?
Ooh, that's a big question. And I think we're going to have to leave it there for today. It's almost like we've zoomed out from this one report about German hospitals, and now we're looking at, like, the whole global healthcare system.
Right.
I mean, every country is dealing with its own version of this, right?
Oh, absolutely. Healthcare systems everywhere are facing these huge challenges. It's a global issue for sure. But I do think that this deep dive we've been doing into the German situation,
Yeah.
it's actually revealed some pretty important insights.
Yeah, for sure. Like, one thing that really struck me was just how adaptable hospitals are having to be.
Right.
Like, they're really having to think outside the box to figure out how to deliver care with fewer resources, how to streamline things, how to just make it work,
It's true. They're really being forced to innovate in a lot of ways. And I think, honestly, some good could come out of that in the long run.
Totally. And then the other thing, and this is maybe even more important,
Yeah.
this whole idea of collaboration over competition, like, that's a pretty big deal.
Oh, huge. For so long, it's been every hospital for themselves. But now they're realizing, maybe they're being forced to realize, that they're all in this together.
Exactly. A rising tide lifts all boats, or however that saying goes.
Exactly.
And I feel like that's a message that goes way beyond just, German hospitals.
Yeah.
I mean, isn't that something we could all use a little more of these days? A little less, I've got to win no matter what, and a little more, hey, maybe we can actually help each other out here.
I'm 100% with you on that. We need to focus on building a system that benefits everyone.
Right. Because at the end of the day, isn't that what really matters?
Absolutely.
It's about making sure that everyone has access to quality health care. And maybe, just maybe, that starts with hospitals being willing to, work together a little more, share resources, all of that.
It's about the big picture, right? Taking care of everyone.
Exactly. Okay, wow, we really went deep on that one. I'm feeling a little inspired, I'm not going to lie.
As you should. It's important to be hopeful.
It is. And you know what else is important? Listening to podcasts. So, to everyone who tuned in for this deep dive into the world of German hospitals, thank you. We really appreciate you being here.
Yes, thank you. Always a pleasure to be here and chat about this important stuff.
And hey, who knows? Maybe this is the start of a global healthcare revolution. Stranger things have happened, right?
You never know.
Until next time, everyone, stay healthy out there.